Dr. Anthony Miller has so much I can hardly tell you at all that I won't. I'll simply say that he is a professor emeritus at the Dal Atlanta School of Public Health at U of T. And he's also the director of the Canadian National Breast Screening Study, which is another huge thing that he's done in the UK. He joined Medical Research Council Tuberculosis and Chest Diseases Unit way back in 1962. He's been a director of epidemiology at the National Cancer Institute of Canada. And he has dealt with preventative medicine. He's done so much, not only here and in the United States, but in Europe. And so he has a long background. His topic tonight is a very challenging one, and there are many perspectives on it, but it is seriously an issue in terms of environmental health and this whole EMF, electromagnetic fields. Very interesting and extremely important as we get more and more into making interesting challenges over the airwaves. So, Dr. Anthony Miller, welcome to this presentation, and we are looking forward to hearing from you.
What I'm going to talk about tonight is that the whole question of electromagnetic fields, and more particularly a subcomponent of them, which we now call radio-frequency radiation. The radiation, non-ionizing radiation that powers our cell phones, comes from the cell towers, and which will be very prevalent, even more prevalent than now, if what is now called 5G, the fifth generation modulation of distribution of radio frequency fields is introduced in Canada, as is already planned, I gather, for various parts of this country. Now, I first got involved in studying electromagnetic fields many, many years ago when I was approached by the provincial generating and electricity distribution authority in Ontario, Ontario Hydro, to advise them on a study of their workforce, because they were concerned, as was the workforce, the people in charge of the workforce in Hydro-Quebec and Electricity de France, that the electrical and magnetic fields their workers were exposed to was causing ill health. And we essentially conducted the tri-utility study, Ontario Hydro, Hydro-Quebec, Electricity de France, and we were particularly fortunate in the Ontario component that there were physicists working in Ontario Hydro that were able to carefully identify the intensity of electric and magnetic fields their workers were exposed to. And what we found was that the workers who went in and out in their work, in generation, in exposure to transmission lines, they had intermittent exposure, particularly to electric fields, had an increased risk of leukemia and non-Hodgkin's lymphoma. And we pursued that with a case control study of childhood leukemia in Toronto. And we were able to quantify the extent to which children were exposed to electric or magnetic fields. And we found the predominant risk was related to magnetic fields, and that there was a strong relationship between rather poor wiring in a home where the conductors were kept apart. When they're together, the fields tend to neutralize one another. But when they're kept apart, the fields are generated and childhood leukemia. And we weren't the only people to identify this. This was identified in studies elsewhere. Over the years, I have had the good fortune to interact extensively with the International Agency for Research on Cancer in Lyon, the World Health Organization Specialist Agency for Research on Cancer. And I spent some years there. And fairly recently, I spent time there after the International Agency for Research on Cancer had set up a special review of radiofrequency radiation. And what they do after such a meeting is that they have their own scientists and invited scientists, and I was invited scientist, to review the documentation and make sure it's carefully cited and is correct. And I did that for some months, and I was impressed by the fact that there was increasing amount of data that suggested that radiofrequency radiation, the non-ionizing radiation that powers cell phones, mobile phones, was increasing the risk of cancer, particularly brain cancer, because when people hold their cell phone over their ear, the radiation goes into the brain, particularly the front of the brain and the side of the brain next to the ear. And the risk of frontal and temporal lobe brain cancers is considerably increased when people have used mobile phones for many years, particularly if they start early in life. In addition, we were aware that studies were going on of human populations, particularly in Sweden, where radiofrequency radiation was first used for powering cell phones. And the epidemiologist there, Dr. Lennart Herdell, identified the fact that people who had a prolonged exposure to radiofrequency radiation from cell phones had an increased risk of glioma, glioblastoma, the most malignant form of brain cancer. Since then, we've become aware that it's not only the ear which is exposed to radiofrequency radiation, but parts of the body, depending on where the cell phone is kept. If women keep cell phones in their bra, they have an increased risk of rather unusual breast cancers. If men and women keep cell phones in their pockets, then they tend to have an increased risk of colon. And I and Dr. Deborah Davis and another colleague have recently published a paper documenting this increased risk from use of cell phones. So we're in a situation where the radiation, non-ionizing radiation, which people believed would not cause harm because it was not ionizing. Ionizing radiation is X-rays, radiation from uranium and radium. But non-ionizing radiation was thought to be safe, but we now realize it is not safe. In 2011, the International Agency for Research on Cancer brought together a working group to review the evidence then available. and they put radio frequency radiation in what they call group 2B, possibly carcinogenic to humans. At that time, there was no animal evidence. But since then, there have been two major carcinogenicity studies in animals. One in the United States, conducted by the National Toxicology Program, a very large study which has exposed rats and mice to radio frequency radiation at high levels throughout their lifetime. Now, when you do animal carcinogenicity studies, you have to use high levels because you cannot study the numbers of animals equivalent to the human populations that are exposed to these agents. But we believe there is what we call a dose response curve. If you find hazards at high levels, you're likely to have hazards, admittedly much lower, at low levels. And as we now have radio frequency radiation distributed across our environment from cell towers, and unfortunately possibly soon from what is called 5G, which will require a number of small towers in roads with radiation beamed, non-ionizing radio frequency radiation beamed directly into people's homes, then people will get exposed to a greater extent. We already know that this sort of radiation damages plants, insects, and other creatures. There was a second carcinogenicity study of radiofrequency radiation performed by the Ramazzini Institute in Italy, a very prestigious institute that has performed these types of carcinogenicity studies for years. And they found exactly the same as the National Toxicology Program, increased risk of cancer in the laboratory animals, the rats that were used, and perhaps particularly important, they also found changes in the DNA, the genetic material of which we're dependent for our procreation and transmitting our own genes. They found changes, DNA damage in the animals, as well as tumors of the same type that have been identified in humans from exposure to radiofrequency radiation. So we now have a combination of two types of evidence. Animal studies, which we have used for years to help avoid exposing particularly workers and other people to new substances that might be carcinogenic, and which have shown that radiofrequency radiation is an animal carcinogen. And all human carcinogens are also animal carcinogens. So I and many others believe that if the International Agency for Research on Cancer were to convene another working group to review the evidence, they would be bound to conclude that there is sufficient evidence, what we call group 1 evidence, that radiofrequency radiation is a human carcinogen. Now, is there any solution to this? Well, it turns out there is. We can transmit our phone conversations through hard wires, not using radiofrequency radiation, and particularly efficiently, we can use optical fiber, that is, fiber containing light, which will transmit the radio frequency radiation directly to where it's needed in the phone or in the whatever device you're attempting to use. We also can protect ourselves if we insist on using mobile phones by using what people sometimes call safe buds. You put them in your ear and you have the phone away from you, or you keep it as far away from you as possible and use texting rather than voice for transmission. We must remember that we're in a situation where the further away we are from sources of radio frequency radiation, the safer we are. Distance is your friend. So we should use hardwired phones, as I have on my desk next to me. We should avoid using mobile phones as far as possible. And if we have to use them, keep them away, use texting, and use these devices that link directly to the phone. I'm not sure I can say much more about this, except that I do think that one of the unfortunate things about the present situation is that both in the United States and Canada, and in several other countries, but not all, the governments have set up reviews which have come to the wrong conclusion. They have falsely concluded that there is no hazard from radio frequency radiation. That is absolutely not true. And one of the things that people who promote and sell these devices should understand is that the insurance companies now are sufficiently concerned over the risks that they will not insure people against risks from use, from selling these devices, or from the risk from them. So we are in a situation where, unless we are careful with the so-called Internet of Things, driverless cars and whatever, we will be exposing ourselves increasingly to what is in fact, although in low doses, not a great hazard, but in continuous and multiple doses, a substantial hazard that could cause us in the future great harm, and which has already caused people harm where it has been studied. We know that the rates of brain cancer are increasing in various countries, including the United States. This, we believe, is the result of exposure of people to radio frequency radiation. And there are various prominent cases where we believe radio frequency radiation caused the brain cancer these people died of. But I won't go into that now. So that's really my statement. We are in an era where we should, as far as possible, keep ourselves away from sources of radio frequency radiation, which includes things like smart meters. Anything which is called smart, be suspicious of. It's not smart, it's potentially very dangerous. We live in a house in a small town in Ontario. We have a smart meter, unfortunately, on our outside wall, but we are fortunate that the smart meter is separated from the rest of the house by a double garage. And I have equipped myself with a device for measuring radio frequency radiation. And I've confirmed that our exposure is indeed low, and that I don't think the smart meter is doing us any particular harm because of where it's sited. I think that concludes my statement.
To do is continue to thrive and adapt to all these new challenges that surely are coming our way.